Bonjour. Hi, I'm Jasmine Peterson, a Psychological Associate from Sullivan Associates Clinical Psychology. Today, I will be discussing the next topic in our Indigenous Mental Health series, depression. With the decreased stigma around mental health concerns, terms like depression and anxiety have become mainstream. Overall, this is a really good thing, and I am happy people have become more comfortable openly discussing their mental health. However, one downside to this is that the term has become a colloquial word people use to describe any sad feelings. Things like, "Oh man, I failed that test, I'm so depressed." But depression is more than just feeling sad or down. Depression can present in a number of ways. But some things you might look for include feelings of sadness a majority of the time, feeling hopeless like things can never get better, tearfulness or crying, sleep disturbances, either sleeping too much or too little, changes in appetite, either eating more or less than usual, and sometimes resulting in weight gain or weight loss, feeling tired or fatigued, difficulty concentrating, struggling to feel motivated to do things, having less interest in things you used to enjoy or struggling to enjoy something that you once liked, feelings of guilt and self-blame, and feelings of worthlessness. If you or someone you are close to are experiencing any of these signs, it may be time to check in with a professional. Depression can have severe consequences on our well-being and our health. So what causes depression? Depression can be biological or environmental or a combination of both. For some people, depression is passed along through genetics. Some people have what we call a genetic predisposition toward depression, making them more likely to experience a depressive episode in their lifetime. And when someone is depressed, there are generally some specific things going on in the brain. Neuroimaging has helped us better understand how depression affects the brain and how a person with depression's brain might look. There are a number of areas and structures in the brain that can be impacted by depression, or that can be affected by experiences and therefore lead to depressed mood. Within the prefrontal cortex, several structures are notably changed in depressed brains. These parts of the prefrontal cortex are responsible for pain, aggression, sexual function, and eating behaviors, all things that tend to become dysregulated in a depressed person, as well as assessing risk and affecting related behaviors, maintaining executive function, effortful sustained attention, and working memory processes, and evaluating emotional and motivational information. If you caught our last webinar, you might remember that the amygdala is one of the major emotion processing centers in the brain, so it would make sense that the amygdala might be structurally different in a person with depression. And lastly, we have the hippocampus related to the storage and retrieval of memory and emotion processing. Studies have shown that in a person with depression, the hippocampus is smaller. This is particularly true for people who have chronic or recurrent episodes of depression. Neurotransmitters are essentially chemical messengers in the brain that carry messages between the cells. Certain neurotransmitters are associated with feeling happy and well, which is why medication has targeted these specific neurotransmitters. When someone really struggles with depression and therapy helps, but the depression doesn't really lift or is very persistent, they might choose to try an antidepressant. These medications target the neurotransmitters in the brain responsible for happy feelings. There are two major classes of antidepressants: SNRIs, selective norepinephrine reuptake inhibitors, a newer class of antidepressant medication, and SSRIs, selective serotonin reuptake inhibitors. These increase the amount of neurotransmitters, norepinephrine and serotonin, available in the brain and reduce depressed mood symptoms. While some people are born with brains that are more likely to experience depression, other people have experiences that change their brains and result in depression. Research has found that rates of depression are consistently higher for Indigenous people, both on and off reserve. Data collected for the First Nations Regional Longitudinal Health Survey by the National Aboriginal Health Organization in 2003 found that 25.7% of First Nations men and 34.5% of First Nations women living on reserve reported feeling sad or depressed for 2 weeks or more within the past year. For those living off reserve, 13.2% reported feeling sad or depressed for extended periods. This is in comparison to the general population, which has a rate of approximately 7.3% of people who experience depressed mood. So why might First Nations people experience higher rates of depression than others in Canada? There are several reasons that this might be the case, but an important underlying cause for this is intergenerational trauma transmitted through decades and its long-lasting effects on families and whole communities. Colonization and assimilation are considered the root causes of the elevated levels of social and mental distress found in many Indigenous communities today. For a more in-depth discussion of the history of colonization and the trauma it incurred, you can check out our first video in this series, which discusses intergenerational trauma in greater detail. One major result of colonization and intergenerational trauma is disrupted attachment. Studies have shown that separation from a parent during childhood is associated with an increased risk of depression in adulthood. With more Indigenous children in care now than were in residential schools at the height of enrollment, the issue of disrupted attachment is both historical and current. Healthy familial relationships are also important for developing self-esteem, which is another way in which broken attachment can lead to depression for individuals. For families who have parents, grandparents, aunties and uncles, and so on who attended residential school, the effects of the abuses endured there continue to affect attendees and their families to this day. The psychological effects of having suffered abuses can be passed down through generations, not only through experiences, but also at a genetic level. Furthermore, the disruption of spiritual well-being may be of particular concern, as the connection to spirituality has been shown to be a resilience factor. Having had this stripped from them, many survivors of residential school therefore suffered from depression and had limited resources to cope. The disconnect from spiritual and traditional ways of living can also be transmitted through generations. The residential school system removed important protective factors, and the effects are still being seen today. Intergenerational transmission occurs through the social environment. Children of depressed parents are exposed to and learn from the mother's or father's maladaptive or negative worldviews, behaviors, and emotions. Stressful conditions, such as increased levels of parental conflict, separation, and divorce, and physiology, with research suggesting that parental depression is associated with vulnerabilities in the physiological regulation of stress in children and increased levels of cortisol, the stress hormone. So what are some things you can do? Research has shown that people who tend to notice and be grateful for even small good things in their life tend to be happier. Try finding gratitude daily, seeing the beauty in a sunrise or a flower, acknowledging the pride in a task you have accomplished, or appreciating the comfort you felt from a hug from a friend. Humans are social beings. Even introverts need close relationships. Spending time with others tends to boost our mood. Try texting a friend, attending an event like a hockey game, or if you feel like there is nobody that you are close to that is available, going to a public place where other people are can help too, like hanging out at a mall or even heading over to the Northern. Physical activity can increase happy hormones in the brain. Get moving to get happier. Research has consistently shown that connection to tradition and culture is a resilience factor, meaning that it can buffer against things like depression. So get out in the bush, do some fishing or hunting, attend a ceremony, or maybe eat some bannock. It could lift your mood. These are just a few ideas to try if you are struggling with low mood. However, if you are having a hard time and your low mood will not lift, even with some of these activities, think about checking in with a professional. Depression can lead to more significant health issues, so it is best to get treated either through medication, therapy, or both to ensure a healthy you and healthier future generations. Thank you for joining us today. I hope you have found this useful and that it can help you or a loved one live a healthier, happier life. Check in again soon for the next title in our series on Indigenous mental health.